I'm going to moderate today's session. Thank you everybody for joining today. I'm Rob Schwartz. I am going to moderate today's session. I am the Executive Director of the Ontario Tobacco Research Unit. We are hosting on behalf of an entire group of folks and organizations today this webinar on Whither, Canada's Tobacco Endgame, looking back and looking forward. And we've got a really great panel of people to discuss what has happened in the past 5 years and hopefully some good things that will happen as we move forward. I'm going to start with a land acknowledgement, and then I will introduce all of our speakers briefly, and we will get going. So welcome everybody to today's webinar. I understand and know that people are joining us from many places. And as I read the land acknowledgement for the place where I am right now, which is Toronto, very near the University of Toronto, I hope that each of you will keep in mind what the land acknowledgement signifies for the lands where you are currently residing or from where you're taking this call. So I wish to acknowledge this land on which the Dalla School of Public Health and the University of Toronto operate. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful for the opportunity to work on this land. I'm delighted now to welcome a wonderful panel of speakers, and I'm going to introduce them briefly. Elizabeth Eisenhower is really the progenitor of this whole Tobacco Endgame Summit 5 years ago now. It was a great pleasure to meet her. She is a medical oncologist and for 30 years has led a national program of investigational cancer clinical trials within the Canadian Cancer Trials Group. She was the professor and head of the Department of Oncology at Queen's until 2017. Upon retirement, in quotes, she became Professor Emerita, and she, since January 2018, is the innovation lead at the Kingston Health Sciences Centre. Rob Cunningham is a lawyer and senior policy analyst with the Canadian Cancer Society. He's been involved with tobacco control for more than 30 years. Les Hagan is the Executive Director of Action on Smoking and Health and an adjunct professor at the University of Alberta School of Public Health. ASH is based in Edmonton and is one of Canada's leading tobacco control organizations. Michael Chaitin, my colleague, is an associate professor at the Ontario Tobacco Research Unit, Dalla School of Public Health, and a scientist at CAMH, the Centre for Addiction and Mental Health. He's been leading CIHR-funded research in tobacco since 2010. Jeffrey Fong. Jeff is a professor of psychology and public health sciences at University of Waterloo and senior investigator at the Ontario Institute for Cancer Research. He is the PI of the International Tobacco Control Policy Evaluation Project, the ITC, which since 2002 has conducted cohort surveys of tobacco and nicotine product users in now 30 countries. The Honorable Jane Philpott is the Dean of the Faculty of Health Sciences and Director of the School of Medicine at Queen's University. Dr. Philpott is an accomplished family physician, educator, and global health champion, and is best known for having held several senior cabinet positions with the Government of Canada. And finally, Dr. Andrew Pipe was formerly chief of the Division of Prevention and Rehabilitation at the University of Ottawa Heart Institute and is a professor in the Faculty of Medicine at the University of Ottawa. Dr. Pipe continues his clinical and research activities within that division, and he has been called Canada's foremost expert on smoking cessation. He was instrumental in the development of the widely adopted Ottawa model for smoking cessation at the Heart Institute. So that's a bit of a mouthful. I tried to do it quickly because we want to get to the essence and hear what all of these important people have to say. And so It's my great pleasure to ask Elizabeth Eisenhower to give her comments.
Thank you very much for your kind introduction, Rob, and it's a great pleasure to be here today with such an august room full of virtual people. I speak to you from the lands of the Anishinaabe and Haudenosaunee peoples here in Kingston, Ontario at Queen's University, a place that I feel privileged to live, work, and play in. So I'm going to start the story by looking back at the 2016 summit and asking whither Canada's tobacco endgame. And in the next 5 minutes, I'm going to really outline why we thought a tobacco endgame for Canada was needed in the perspective of 2014 when this work started, what we did to build towards a summit and setting an endgame goal, and the outcomes of that summit. So back in 2014, it was clear that tobacco remained a problem despite people feeling that maybe we'd actually triumphed over tobacco as an issue. We knew that progress was slowing and that millions would be expected to die of tobacco-associated illness each year, with up to 8 million annually by 2013. Furthermore, we knew that the WHO Framework Convention on Tobacco Control measures, if implemented, we knew would reduce deaths, but wouldn't eliminate them. And some of the modeling group that Rob's group did here showed what the very best we might expect in Ontario would be as we looked forward. So very far short of no tobacco. The notion of a tobacco endgame then, and quoting from Ruth Malone, one of its earliest proponents, includes novel initiatives designed to change and eliminate permanently the structural, political, and social dynamics that sustain the tobacco epidemic in order to end it within a specific time frame. So it set goals in a time frame with a focus on commercial tobacco. So with some work and support from my colleague Chris Simpson, who was Vice Dean at Queen's in the Faculty of Health Sciences and President of the Canadian Medical Association at the time, and Richard Resnick, our dean at the time, we pulled together a steering committee of leading lights across the country to begin to discuss for a summit where we would hopefully arrive at agreement on a goal and some measures towards achieving an end game for tobacco. And we set, this is just to remind you, there were days when we met face to face. Here we are in July of 2015 doing our homework. The steering committee defined an endgame goal as less than 5% tobacco use by 2035 or less than 5 by 35. And we agreed that that endgame goal could only be achieved through measures that would affect both prevention of new smoking and cessation of current smokers. Neither one alone would achieve that degree of reduction in tobacco use. And the steering group then set up 4 different action groups that were challenged to develop a background paper highlighting the measures that could be used in a comprehensive endgame strategy for Canada. And by the summer of 2016, a fulsome background document, a fairly lengthy novel, if I might say, was put together with the various topics addressed here and collectively recommended 41 options for endgame measures. On September 30th, 2016, about 85 people from across Canada, from government and non-government, from clinical physicians and non-physicians, from advocates and from others, came together at the Donald Gordon Center at Queen's University for a 2-day meeting where each of those areas in the background document were discussed and debated. The outcome of the summit was a universal agreement on the need to develop an endgame strategy for Canada for commercial tobacco to achieve the less than 5 by 35 goal. And the key areas for action were too long for a single slide, but I highlight many of them here. Changes in the product itself, making it less addictive and appealing. aligning tobacco supply with public health goals rather than commercial goals, changing tobacco supply parameters around taxation, price controls, and reduction of availability. The notion that cessation programs should leave no smoker behind, and the prevention of a new generation of smokers through a variety of measures. The report of the proceedings, which were circulated to you in advance of this webinar, were widely distributed online, and we agreed to move this volunteer effort forward by the creation of an Endgame cabinet comprised of committed individuals and organizations, with the ultimate goal of turning this curve into that. The story of what happened next over the next years will be the subject of the speakers that follow me, and I thank you for the opportunity to present a little bit of our history and set the context for today's webinar.
Elizabeth, thank you so much for setting us off and reminding us of the history of where we came from. And now Rob Cunningham of the Canadian Cancer Society is going to start letting us know what has happened since then.
Can you see my screen?
Yes.
Thank you. No. All right, so the objective of under 5% by 2035 was endorsed by the federal government in May 2018, but has not yet been endorsed by any other province or territory. Here we see the current federal, provincial, the current tax rates by province and territory. And we see Quebec and Ontario, our largest population provinces, are far lower than other provinces. We have had federal tobacco tax increases, $8 since 2018. There's been various other provincial territorial tax increases. Federal tax is now indexed to inflation. But particularly significantly, since 2014, the tobacco companies have had dramatic increases in their own prices of $20.20 per carton of 200 cigarettes, more than any particular province or the federal government. And when you add it all up, federal increase, provincial increases, manufacturer price increases, and sales tax of 5 to 15% on all of that, we've had dramatic price increases, more than $30 per carton in any province, $44 or more in 2/3 of the country by population. And this has been the biggest factor that have influenced lower adult and youth prevalence and per capita consumption in recent years. Plain packaging has been implemented. And we see here how it's going to get better in February. On the left are the flip top packs. On the right are the slide and shell packs for both 25 and 20 cigarettes. And you can see how the warning image gets much bigger. The industry did not want this. Canada has banned slims and super slims and 100 millimeter cigarettes better than any other country. Our plain packaging regulations are the best in the world. At the time of the summit, there was substantial action on flavors by a few provinces. More provinces have taken action. There's now a national ban on menthol in cigarettes and all tobacco products, but in some provinces, there remain quite a few flavored products. More provinces and territories and municipalities have restricted smoking in more outdoor areas. There are now 100 campuses that are 100% smoke-free compared to 15 5 years ago. Saskatchewan has banned smoking in all social housing. Nunavut is about to be the first to ban smoking in construction sites. PI is the first province to have minimum age 21 in Canada. Nunavut has done something that no province has yet done in terms of controlling the industry promotion to retailers, a huge area of promotional activity. Nunavut has been, as Northwest Territories has done, having a lower price based on the quantity sold, allowing manufacturers to have lower prices for different retailers, or manufacturers giving any type of bonus or promotional incentive, such as if their sales volume targets met and so on, to retailers. In 2018, the federal government increased funding by $16 million per year, reversing reductions in funding that had been made in 2012 by the prior government. Newfoundland has increased funding, but no other province has in any material way. In the last election campaign, three major parties had in their platforms a tobacco manufacturer cost recovery fee, so that the tobacco industry will be required to reimburse $66 million of the federal government's annual tobacco strategy. E-cigarettes have been a major issue. 5 years ago, they were not even legal in terms of e-cigarettes with nicotine. They were legalized in May 2018. Youth vaping has increased dramatically, as has young adult vaping, and a series of measures that governments have implemented in terms of taxation, maximum nicotine level, advertising restrictions, flavor restrictions, and more, with more in preparation, at least federally, and in some provinces. The federal government is working on a new round of health warnings for tobacco packages. And as part of a consultation, there was to have a warning directly on the cigarette itself, but this has not yet been completed in terms of a regulation. And finally, we've had on the litigation front. In March 2019, the tobacco industry had a major loss before the Quebec Court of Appeal, $13.5 billion. They sought and obtained credit protection, which suspended all proceedings against them. Last 2 years, there's been confidential negotiations underway between provinces, tobacco companies, and the class actions. We don't know what's going on. Provinces have a historic opportunity to reform tobacco industry behavior, to get public health measures in the settlement. We saw in the United States how Purdue, the opioid company, because of a settlement of some similar nature, is fundamentally changed. We need to do that in Canada. And as part of public health measures, there needs to be substantial long-term funding to reduce tobacco use, including at least 10% of all proceeds from any settlement. Thank you very much.
Thank you, Rob. Really helpful to see all that in so concise and so clear. It sounds like a lot has happened. Now we're going to ask Les Hagan from Action on Smoking and Health to do a bit of a reality check. How does all that compare with what we may have expected given the Tobacco Endgame Summit? Go ahead, Les, please.
Thanks, Rob. Just having an issue sharing here. Just one moment, please. It's not like I haven't done this before. Rob, I'm going to ask you to go on to the next speaker. Sorry about this.
Okay, we'll come back to Les, and I'll now ask Michael Chayton to give us a bit of the actual population level data. So what has happened since the Tobacco Endgame Summit, and to what extent, we might say, have the policy measures mentioned by Rob Cunningham actually played out with population level change. So Michael, over to you.
Thanks, Rob. I'd like to acknowledge that much of the data and the slides actually came from David Hammond, as well as a few data points from Rob Cunningham as well. And so I'm just going to briefly look at the current situation in terms of population tobacco and nicotine behavior changes. What we've seen since the Endgame Summit is a continued decline in the number of cigarettes sold and the number of people smoking cigarettes. This graph shows the per capita cigarette consumption. So this is data reported to Health Canada on how many cigarettes have been sold in any particular year, divided by the number of people in Canada. And we can see that there has been a significant decline, a 31% decline, since the time of the Endgame Summit. The current year, we're still waiting for final official government numbers, but data from Philip Morris, which has been predictive of final numbers, suggests that that decline is continuing in 2021. That number of cigarettes smoked is consistent with our decline in the number of current smokers. So back in 2000, there were 6.7 million smokers in Canada. And despite the number of people in Canada having increased since that time, we are now down to 4.7 million smokers. That is still millions and millions of smokers in Canada, but a significant decrease that we've seen over the past 20 years. The data on smoking prevalence is less solid than it has been in past years. Currently, the most recent data source comes from the Canadian Nicotine and Tobacco Survey, which does show a decline of smoking prevalence and a 10% smoking prevalence rate in 2020. However, differences in survey design, in the number of people answering surveys suggest that we may not be as comfortable in the absolute level of smoking prevalence numbers as we have been in the past. Nevertheless, these data are consistent with our consumption numbers and sales data. And we see that past day smoking declines of about negative 12% decline among those 25 and older, a huge decline among those who are in the 20 to 24 range, and a small decline among already low numbers among people ages 15 to 19. Of course, since the summit, there has been a major change in the nicotine and tobacco market. With an increase from about 8.7% past 30 days vaping prevalence in 2017, according to data from Dave Hammond, to a high in February 2020 of 19%. The number of vapors seem to have dropped during and shortly during the peak of the pandemic in Canada, but in Canada seem to have rebounded, currently at 15.7%. That's another significant increase. And we'll have this data hopefully confirmed with other studies shortly. But there are a couple of things that have not changed over the past 20 years. And one of them is there has been no change in quit attempts over time. Smokers tend to, about half of smokers report quitting, making a quit attempt about once a year. So that's currently the most recent data is about 45%, but again, that number has been consistent for the last 20 years and more. And similarly, the quick success rate per each quit attempt, this is the percentage of smokers who have tried to quit for at least 24 hours in the past year who were abstinent at the time of the survey. This particular percentage is also inclusive of people who made multiple quit attempts, but that success rate has remained remarkably steady, again, for decades and even before this period of time, suggesting there is much more we need to understand or to do to help increase the quit rate. It takes smokers many attempts to quit. And increasing that number of attempts is one of the key ways of ensuring reducing prevalence. We also know that there is substantial disparities in the population, both in terms of smoking rates and quick success by many different demographics, such as age, race, where people live, and level of education that continue to persist today. Thank you.
Thank you, Michael. That's lots of developments. I'm going to ask Les, are you able now to share your screen?
Yeah, and I'm getting some help from Sonia. So she's going to put the slides up.
Okay, wonderful. Okay, take it away.
Great, thanks everyone. Good to see you. My presentation today is based on a recent commentary on 5x35 that was co-authored by Rob Schwartz and myself. Let's start with the good news. First slide, please. Canada has already achieved 5x35 among the most important target group, youth. And as you can see here from the Canadian CSTAD's data, the last 3 national surveys have shown that smoking rates among those aged 12 to 17 was below 5%. This achievement is no small feat, and it has resulted from decades of concerted efforts by health organizations, advocates, academics, governments, educators, and many others. Collectively, we know what it takes to drive down youth smoking. The challenge is to keep doing just that. Next slide. However, with close to 400,000 underage youth now vaping, the ability to keep youth smoking at its current level is now in question. Youth who vape are at least 3 times more likely to start smoking. The explosive rise in youth vaping in Canada followed a similar trend in the US, and just like the US, the Canadian government rolled out the red carpet to Juul and others by refusing to align existing and effective restrictions on tobacco with those on vaping. Next slide. The government ignored the advice of numerous health organizations who warned that Juul and others would fully exploit any loopholes provided, and they did just that. The same governments are now desperately trying to reverse engineer the resulting youth vaping epidemic without much success to date, according to the latest ITC Youth Survey. Next slide. Another recent blow to tobacco reduction was the legalization of cannabis in 2018. Canada was and remains the only jurisdiction in the world to sanction the widespread public consumption of cannabis with no federal restrictions whatsoever. The federal government deferred public consumption to the provinces, and some have done a better job than others. The problem with public consumption is social modeling to youth and the potential renormalization of smoking. Combined with the explosive rise in vaping, the legalization of cannabis has increased the public visibility of smoking and vaping. Next slide. The permanent closure of 3 of Canada's leading tobacco control organizations in recent years was another major blow to tobacco control. The Non-Smokers' Rights Association was one of the most effective tobacco control organizations in the world, and it was forced to close in 2017, due in large part to a lack of government funding. The Canadian Council for Tobacco Control closed its doors several years earlier. The Ontario Campaign for Action on Tobacco closed last year. The capacity of tobacco control organizations in Canada is now at its lowest point in 30 years. To make things worse, the COVID-19 pandemic forced many major health charities to lay off a significant number of staff who were working on tobacco control. Federal, provincial, and regional health departments have suffered from staff redeployments due to COVID-19. Even the Director General of Health Canada's Tobacco Control Directorate was redeployed to the COVID-19 effort. The need for adequate and sustainable funding for tobacco control has never been greater if we want to get our tobacco reduction efforts back on track. Next slide. In my opinion, Canada's tobacco reduction strategy is currently not aligned with its stated 5x35 objective. There are no benchmarks, milestones, or tangible action plans beyond optimistic guidance documents. There is no operational plan to achieve 5x35, and there has been very little buy-in from subnational governments, health authorities, public institutions, and NGOs. Countries that have established similar endgame objectives like New Zealand, Ireland, and Finland have very well articulated strategies with benchmarks, milestones, and concrete action plans. However, this work is far too important to leave up to the federal government only. Every province, territory, health authority, and relevant NGO needs to step up and make a collective commitment to 5x35 and develop a more coherent and well-defined action plan to get there. Hey, I'm just getting started, but I'm running out of time. So I'm going to send you a link to my paper. And I promise to end this somber reality check on a positive note. So next slide, please. Here's a trend line of current smoking in Canada based on CCHS data from 2001 to 2019. As you can see, Canada can achieve 5x35 if we move quickly now. However, the only way we're going to achieve this target is by applying every feasible, effective tool and technique that we have at our disposal. Higher taxes, more smoking bans, age 21 laws, more restrictions on the full marketing mix, more mass media campaigns, smoke-free movies, anti-contraband measures, more restraints on tobacco and vaping companies, more help for smokers, and with adequate and sustainable funding for the entire effort. Less than 5x35 is achievable, but only if we move quickly and collectively to get the train back on track.
Les, thank you so much for that reality check. It actually is a great segue to our next speaker, which is Professor Jeffrey Fong, who's going to tell us what other countries, and I think specifically New Zealand, are doing in actual endgame measures. So it's my pleasure to ask Jeff Fong now to provide your remarks, Jeff.
Thanks very much, Rob. And I'm trying to figure out whether or not I can share screen. Is anything happening?
We're not seeing it. Sonia, okay. Can you help?
What are you not able to do, Jeff?
It says, let's see on a second here. I apologize for this. Let me just try again here, share screen. And it says I'm trying to share, and then the slides is virtual background. Is that where I go?
You want to share your desktop. There you go.
Okay. Are you seeing it now?
It says you're starting to share your screen.
Okay.
Yep, there you go.
Terrific. Okay, thank you so much. I really appreciate the opportunity to talk to you about the international situation with Endgame. A second here. I have to go to the actual, yeah, there we go. Okay, so, are you seeing it now? There we go.
Yes.
Great, terrific. I'm going to very quickly review Endgame approaches in other countries. I'm going to make a distinction between proposals in those countries that are incremental versus those that might or could be disruptive, and very briefly show you one slide from ITC Canada survey on smoker support for new tobacco control policies. So in the international realm, there have been a number of conferences, meetings, and consultations about Endgame. These are two that I was participating in India in 2013 and in Hong Kong at 2017 or 2018. So there's a lot of interest in this. With respect to incremental versus disruptive measures, the incremental I would consider to be stronger implementation of FCTC policies, also known as WHO's power measures. These include greatly increasing taxes, active and sustained media campaigns, and total smoke-free laws, and also extensions of FCTC policy domains. For example, plain packaging and tobacco 21, increasing the age of purchasing. So these incremental policies have been completely underutilized throughout the world. This is a article that we published in Lancet Public Health in 2017, showing that countries that do more to implement just the FCTC main 5 measures experience a significantly greater reduction in smoking prevalence over the first decade of the treaty. So incremental measures are very important throughout the world. But there are potentially disruptive measures that are being considered right now. For example, linkage of tobacco control to broader objectives, for example, especially tackling the inequities in health, and to determine and to promote approaches to tobacco control that can actually tackle these inequalities in health. There are strong supply measures that are being considered, significant reductions in the number of retailers, significant reduction in the breadth of tobacco retailers, focusing the places where purchasing can take place into a very small set. Finally, there are product regulations designed to reduce appeal and addiction. This is a very underappreciated and underexplored aspect of tobacco control. Banning flavors, banning filters, requiring very low nicotine in combustible products. And I think that this is a domain that has substantial and significant possibilities for decreasing smoking prevalence to endgame levels.
Jeff,
yep.
Jeff, can I stop you for a sec? I don't know if your slides are supposed to be advancing. They're not on the screen.
They're not.
It's fine if they're not, but because we can hear you fine.
Okay, let me just see here. Maybe I should go with this. Can you see it now?
They're not advancing. I think just continue though.
Okay. Well, very low nicotine cigarettes have been shown in clinical trials to enhance reduction in cessation without compensation among smokers. And simulation modeling conducted by the US FDA suggests that there's astonishing potential in reducing smoking among smokers and preventing uptake and progression to regular smoking. Of course, there are risks, notably, of course, illicit trade. And there is a possible role that alternative products, non-combustibles, might play in the carrot stick approach to greatly reducing smoking. There are a number of countries with endgame goals, but I'm going to skip directly since you can't actually see any of this. So why not advance the slides to talking about New Zealand. New Zealand's proposals for a smoke-free Aotearoa 2025 action plan consists of 5 main areas. 3 of them I would consider to be potentially disruptive and novel. Strengthening the tobacco control system with Maori governance, community action, reducing availability, limiting retail outlets and store types, retailer licensing and possible smoke-free generation policy, and especially considering what I said before, reducing addictiveness and appeal through mandated very low nicotine cigarettes, prohibiting filters and other design innovations that lead to people, kids starting and being attracted by them, and smokers with the difficulty they have in quitting. So there are support measures that we always ask in the ITC surveys. We find that there is a significant level of support for reducing nicotine in cigarettes to make them less addictive. The majority of smokers even, and ex-smokers all agree, would support this. And so in getting Canada to move toward less than 5 by 35, we need a bold tobacco control strategy that both significantly advances ongoing policy domains and includes potentially disruptive new policies and regulations, like New Zealand. New Zealand is at the forefront and is moving forward quickly. There are opportunities to see what New Zealand is going to be doing in the next few years. The ITC project is in New Zealand, will allow us to examine, evaluate, and understand the impact of these leading edge policies. Canada needs to do something. What I would hope is that Canada considers some of the more disruptive policy and measures and opportunities that may lead to significant advances in getting to less than 5 by 35. Thank you so much. Sorry the slides didn't advance.
Thank you, Jeff. You speak so clearly and with such passion that we can envision the slides without actually seeing them. So thank you. And, it's really good to be moving forward and understanding how other countries, have actually adopted or are adopting disruptive measures. Jane Philpott, it's really a pleasure to have you here to speak with us about moving recommendations to action, the perspectives of a former health minister. Please take it away.
Well, thank you very much. And I am delighted to be joining you today. It's a great opportunity for me to get an update from those of you who spend your whole lives and careers working on this incredibly important work. Like Elizabeth, I'm joining you from Kingston, Ontario, traditional territory of both the Anishinaabe and Haudenosaunee peoples. And I'm looking out at beautiful Lake Ontario, just a short paddle down from where Elizabeth is, if we could get to each other by water pretty easily here today. And I'm really pleased that Elizabeth invited me, amongst others, to share a few comments at the Tobacco Endgame Summit. It took me back to my days as Minister of Health and thinking about how the tobacco endgame was a really important part of that portfolio. I remember very specifically, in particular, a forum that some of you were probably at, the National Forum on the Future of Tobacco Control in Canada in the spring of 2017. It was just a few months after that I was moved to another cabinet portfolio, but I remember that event fondly. It was a large group, and there was a tremendous amount of enthusiasm in the room for this work. As those of you who will recall, we were at the stage where we knew that the current, at that time, federal tobacco control strategy was set to expire, and it was really an opportunity to map out what it sounds like we're ready for again. But at that point, it was time to really map out a bold federal approach with a target in mind, that the target that's been referred to now several times in terms of reducing tobacco use in Canada to less than 5% by 2035. And so it was, when I was asked to prepare a talk for today, it gave me a chance to do a bit of a review. You've further enhanced my review by hearing these presentations that preceded me, but I did a little bit of my own homework in terms of sort of seeing, well, how have things been doing, since this hasn't been completely preoccupying my time in the intervening years. But it is actually very encouraging to see the rates falling in smoking rates. And StatsCan was obviously one of the go-tos that indicates that at the time in 2015, when I started off as Minister of Health, the rates overall for adults were 17.7%. And the StatsCan data has the 2020 rates listed at 12.9%. So as Les said just a little while ago, if we keep that pace of decline, we will drop below 5% by 2035. But as others, even some of the commentators in the comments here have noted, and we've always known, the closer we get to the 5%, it's always that last mile strategy that's the critical one. So, there is lots of good news, though, and I really particularly like the fact that while smoking is declining among all age groups, we do see this even faster pace among teenagers with a 50% reduction. So that's certainly, as others have said, needs to be interpreted with caution due to other factors. But of course, we are hopeful for future generations that the low rates of tobacco use will continue. I think it's safe to say that there has been an effective denormalization of tobacco in particular as a contributor to reducing use. And I know how much many of you in this room have spent literally, decades of your life in this battle, how effectively you have advocated for the introduction of better versions of plain packaging, for restrictions on advertising, the takedown of the power walls in the stores, and many other examples of things that you've done. I share with those of you who have mentioned this or provided comments on this, the concern about the uptake of vaping. That early on there were, and in an ongoing way, there has been a great diversity of views on this amongst even public health professionals around vaping as a harm reduction tool for cessation versus this very significant and serious risk of introducing new users. So we have certainly seen these increased rates that everyone feared, and of course correction is needed, and I know that's part of what many of you are working on. I want to also say, just in terms of the things that worry me, and I think Jeff alluded to this a little bit, is I do worry about who's being left behind. Those first, going from roughly 18% down to roughly 12%. I think those people and populations are different than the people and populations that occupy the space between the 12% and the 5%. I'm thinking about the challenges of the populations that are potentially going to be the hardest to reach. People living with trauma, with structural marginalization, with other contributory factors of mental illness or addiction. And it's no secret that the use of tobacco is disproportionately associated with other health and social challenges. And I don't think that this conversation should take place without acknowledging that larger context of people coping with addiction. And I would argue that Canada needs a strategy that is not only bold and comprehensive, but needs to be compassionate and needs to be trauma informed. So let's look back a little bit on the progress again, and a few thoughts on how it can go further. I am really proud of the things that we did get done in the 2 years that I was Minister of Health from 2015 to 2017. It was during my first year as minister that the legislation was introduced requiring plain packaging, and it makes me really proud to hear the acknowledgement that plain packaging is the best in the world, and that was certainly the goal at the time. And some of you who are here today came to see me. I still remember sitting around various tables in my minister's office, people literally tossing out some of these samples of plain packaging and warning labels, and starting to imagine what it would look like, and to see that those regulations are continuing to roll out has been really great. So I want to thank Rob Cunningham for some of the updates that you provided in terms of how the plain packaging regs have been effective. I also think this is a good time for me just to give a shout out to people at Health Canada, the public servants. Many of you know, and maybe some of you are even on the call, but many of you know they really enormously talented and determined public servants who pushed for this, who were really happy when they had a medical doctor as health minister who was receptive to the things that they had been working on for years, and they were ready to flip the switch and move into action. It was shortly during my departure from Minister of Health, as I moved over to Indigenous Services, that we secured the funding to support tobacco control, and I was really happy to be able to move that work along to support these ambitious objectives, and the work that you've been doing to help Canadians quit the use of tobacco, to stop people from taking up the use of tobacco, and to strengthen the science and the surveillance. As well as, I must note, the commitments for funding to work with Indigenous peoples to support culturally safe programming. So there's been progress. What's it going to take next to get to those bold, ambitious targets? Well, I thought I'd spend the last few minutes that I had to talk a little bit about the fact that there's a new Minister of Health, a new opportunity. In case you're wondering, I have to say, I think if I'd looked across the people in the governing party, I think Mr. Duclos was an excellent choice. I have tremendous respect for him, and those of you who will be working with him, I strongly encourage you to build a great connection. He's a supremely intelligent, thoughtful person, and I think he will do really well in this role. He hasn't reached out to ask for my advice on the tobacco endgame, but I thought I'd take this opportunity to share a few things that I would say to him if he did ask me about that. You never know, he might yet. So just in case, though, I'll share a few tips, and maybe you can pass them along if you're in conversation with him. If not, just take it as advice for future ministers of health, the things that I learned about what works and what doesn't. So, being a minister of health, you are constantly battling the short term versus the long term in the priorities of the overall public health landscape. And of course, it's been particularly notable in the last 18 months. There are always going to be urgencies, pandemics, crises in the provinces, crises on reserve. You have to still, though, really make sure that you're thinking about where the puck is going and some of the long game, end game work. We know that tobacco is going to kill more people in the next 15 years than COVID is going to. And so the Minister of Health can't take those long game priorities off the radar. You have to manage the urgent, but as you also have to deal with the important. And so that was part of what we were dealing with, some urgent need to work on things like medical assistance in dying, and we needed to negotiate a new deal with the provinces for home care, mental health, etc. But this work around tobacco strategy was really critical. I will have to say, when I look back on those years in health, I think writ large, the work that was done on drug policy is some of the work that I was most proud about. I was proud to reintroduce harm reduction into the Canadian Drugs and Substances Strategy. We did, I think, really life-saving work in terms of increasing access to supervised consumption sites, for example. But all of that was linked to this ongoing portfolio around tobacco strategy. So the other thing I would say to a Minister of Health is when you're picking a team, one of the things that I found really helpful, of course, I had a benefit of being relatively well informed, I will say, about evidence-based health policy. But I think it's really important for a Minister of Health to make sure they don't just choose political staffers in the traditional term, but really looking for people on the team who have experience in health systems and health policy and public health. And I will say to those of you who are on the call right now that this is the time when ministers' offices are hiring up. So if you are a health policy expert, get in touch with the Minister of Health and throw them your resume right now, because it would be an amazing opportunity to work in that office. One of my staffers had worked on tobacco control efforts and was a really vocal supporter and a staunch advocate and an informed critic when we were working on developing policy around the table. So I will also just go back to the really important role that the minister has in working with officials. I cannot overemphasize how hard public servants work and how much on a topic like tobacco control, they are under amazing duress. They are aware at all times that their emails and their agendas are going to be ATIP'd by tobacco companies. They are harassed when they go to international conferences. They need support from all of you. They need support from politicians. And they also, I think, do need to be challenged to be more bold, to not accept the status quo, and avoid thinking that they've done as much as they can. Another piece of advice for a health minister is work really closely with your cabinet colleagues. I will have to say that this is one file in which the Minister of Health and the Minister of Finance get along really well, because we know that higher taxes, it makes the finance minister super happy, but it's also correlated with lower consumption. And so tobacco taxes are a win-win, but those are maybe the two people around the table that are most enthusiastic about this policy. Of course, people from science and innovation sometimes have different views. The Minister of Rural Economic Development sometimes has different views. MPs who have tobacco producers in their ridings, all of those people have to be taken into consideration. And of course, any Minister of Health thinking about tobacco has to really understand the cultural and ceremonial importance of tobacco in Indigenous cultures, so that you don't step on put your foot in your mouth in the wrong way. But let's get back to some of those diverse perspectives. And I really want to emphasize as well how much the health minister needs to understand what lobbyists do and how they work. And honestly, some of you should really, that's a great thing when you're going to meet with ministers to talk to them about. It's a global industry. We all know that the WHO framework means ministers can't meet with tobacco lobbyists, but tobacco companies are part of conglomerates and they have parent organizations, and the parent organizations are often cannabis companies or alcohol companies. So ministers need to be very, very careful, as do their staff. And the last thing I'll just say is, as Dean of Faculty of Health Sciences, I want to just really emphasize the role of research and emphasizing how we need to expand research, as well as international engagement and knowledge mobilization. The literature on addiction, on behavioral therapy, on trauma-informed care, on public health interventions, it's always evolving, and always it needs to be advanced in terms of our understanding of the harms of tobacco use and how they can effectively be minimized. So don't ever forget to put in your plug as well for further investment in the funding of health sciences research. I love the international perspective that's been brought here. I think that imitation is the most sincere form of flattery. So let's imitate the best, and let's look for others around the world to imitate what we're doing. We certainly stole ideas from Australia, and it's time to steal from other great places. So stay engaged, keep pushing for new knowledge. And I will just say to the researchers in the room to be vigilant, to keep talking tough. Make sure that you provide solutions to health ministers and officials, because they need to know what you know, and don't assume that they can find it easily. So the more you can package it up and present it to officials in all orders of government, the more effective you'll be. Some of the people in this room, like Rob, both Robs, many others have been so engaged with policymakers over the years. You've delivered really tough advice. And so credit to those of you who really did that effectively, but those relationships will be even more critical in the future if we're going to reach the goal of less than 5%. So don't stop what you've been doing, do it more. Thank you.
Thank you so very much. It's a real honor to be able to hear some perspectives from the position that you filled. Your advice to the future or the now current health minister, and some advice to all of us on how to continue to try and make a difference. So hugely appreciated. Thank you so much. And we do know that you also have another important meeting that you need to get to. But we are going to continue, and you've started us by looking into the future. And I'd like to ask my colleague, comrade in arms, I might say, Dr. Andrew Pipe, to start us off by giving your perspectives on where do we go from here, Andrew, and how are we feeling about where we are at? So I'm going to hand it over to you.
Well, thank you very much, Rob, and thanks to all who've enlightened us today with their wisdom and their insights. In the interest of complete transparency, I must tell you that I'm not actually sitting on University Avenue in Kingston, Ontario, amidst the campus of Queen's University, as this background might suggest. It is, however, to pay visual homage to the site of the summit some 5 years ago, and also to allow me to say that when I graduated from medical school on this campus at some remote point in the last century, some years after just some few years after the reports of the Surgeon General and the Royal College of Physicians and Surgeons from the United Kingdom, I naively assumed that this was an issue that would be dealt with by governments being insightful and imaginative and regulating an industry in the way that they regulate every other industry, the automobile industry, the pharmaceutical industry, the food and drug industry, and that this would be dealt with. Never really, in my naivety, assuming that we would be confronting an industry which is unrivaled in its duplicity, unrivaled in terms of the damage that it does as a result of the consumption of its consumer products. So what about the future? What about the past? What are the opportunities? Well, again, perhaps in my naivety, I say that we have a new government that is committed, it would seem, in terms of their platform statements and the platform statements of the parties that are likely to provide them with support, that they favor bold approaches to tobacco control. So we do have opportunities. And I think it's very important that we reinvigorate through our support of Health Canada, through encouraging them to be vigorous and vigilant in terms of their capacity to address the tobacco pandemic and the tobacco industry, to be much more robust, to be much bolder in terms of regulating the industry through licensing, through taxation, and using that licensing and that taxation to fund the programs and the processes that will be necessary to reduce smoking to less than 5% by 2035. If not a single new customer comes to the tobacco industry from today onwards, we will still never reach less than 5 by 35. I'm also naive enough to think that we might be able to experience some post-pandemic enlightenment. The idea that as a consequence of the public health challenges that have been faced in the past 22, 24 months, that governments will be more receptive to the ministrations, to the advocacy of public health organizations, health scientists, researchers, and clinicians. On the other hand, I must temper that by the realism that can be seen in provinces where there has been complete indifference, if not intransigence, in terms of responding to the supplications, of health professionals, clinicians, and researchers, speaking specifically about government's responsibility to addressing the COVID pandemic. Both of those elements, however, mean that I think it's incumbent on for all of us to be much more vigorous and much more clear and much more articulate in terms of making our views known. There are two causes of disease, said Virchow. One is pathological, the other is political, and it will be public policy changes which will allow us to move forward into the future. I commend the article written by Les and Rob, which looks at the impedimenta which might preclude us reaching less than 5 by 2035. The tobacco control is aging. At the risk of causing her embarrassment, I must point out to Elizabeth that there was a typographical error in her opening slide in which she talked about Whither, W-I-T-H-E-R, the tobacco, are addressing the tobacco pandemic. And of course, to wither means to shrivel and age and to dry out. And in many respects, I think the tobacco control community has been withering, and we saw that in some of the comments made earlier about the decline of very important, very vital organizations. It's important that we buttress the capacity within Health Canada and follow the advice that was given by Dean Philpott in terms of providing unmitigated support and encouragement to the new Minister of Health to ensure that those processes are vital and are robust and are very active. In a recent publication, officials looked at Finland's tobacco control program and their legislated approach to reaching an endgame, but pointed out that one of the shortcomings and one of the problems that's being encountered has been a reliance on non-governmental organizations, meaning that governments have to assume fundamental responsibility to get us below 5 by 35. Hence, once again, the importance of our advocacy, our encouragement, and our support of government initiatives. I think I'll leave it there because, as noted, it's very difficult to duplicate the wisdom and the perceptions that have been shared today by such a stellar group of panelists. I thank you for the opportunity to be present today and to revel in the nostalgia of my graduation from medical school, only sadly to be reminded of how we're still dealing with a pandemic, a tobacco pandemic that I had thought almost 50 years ago would have been dealt with within that next decade.
Thank you, Andrew. Anything that I add will just steal from the eloquence of your remarks. I'm just going to give a segue to our discussion now. We've heard from a variety of speakers about where we came from, about where we're at, and potentially about where we are going. All I would like to add is to say that we're not there yet. And despite the data that does show continued decrease in consumption and prevalence of smoking, on smoking, we're not finished. And it may be time that we reconsider what is less than 5 by 2035. Is it smoking of cigarettes, or is it overall nicotine and tobacco use? Les in particular talked about vaping and also spoke about the renormalization of smoking. One thing to know about cannabis smoking is that, at least in Ontario, and I think this is probably true across Canada, some 30% of people who smoke cannabis mix in tobacco with their cannabis, making them actually tobacco smokers. So the pandemic, as Andrew has said, is not over. Part of the reason why a group of us wanted to have this meeting today is to spark once again some excitement around Canada's tobacco endgame, to see what we as a community can do to moving forward, to make sure that we continue to do what we have been doing and we do more. Speaking about getting evidence into policy, the evidence has been cleared for decades already. What needs to be done about this, it still hasn't been done. Jeff points out some disruptive measures that New Zealand and a couple of other countries are taking. We need to push. We need more to happen here and now. And so this is the beginning of a renewed conversation. And we invite all who are interested in joining us to join us in future efforts. At this point, I'd like to turn to open up for some discussion, some questions and answers. It's been very hard for me to follow the chat and follow the speakers at the same time. And so I'm going to ask my colleague, Emily Taylor, who has been following the chat, if you can just highlight a couple of the questions that have come up that you think we can ask the panel to address. Go ahead, Emily.
Sure, I'd be happy to. There's a question here that I'll read out to the group. So this is a question from Matthew Mazer-Goulet. It was directed towards Dr. Phil Pott, but I will put it to the panel. In a world of finite, limited resources and ministerial attention, how do we balance achieving our 5x35 target while ensuring we aren't furthering deepening health inequalities? For example, we know that population-based measures like taxes have broad and positive impacts, but they can also make life more difficult for certain populations. Conversely, focusing on relatively small numbers of vulnerable populations may enhance equity, but not make a large contribution to meeting the 5x35 goal. Is there any advice for public servants grappling with this tension between these two laudable but somewhat opposite goals?
Okay, that's a very well articulated question about the tension between 5x35 and reducing inequities. Would any of the panel venture to respond to that?
Well, let me jump in very quickly, Rob, and say that it's always important to go where the money is and to know where the money is. And the money is to be found in the bank accounts of the tobacco industry, an industry which has almost been untouched in terms of being made responsible on a polluter pay type of principle to fund many of the initiatives and programs that we know will be successful in helping people stop smoking, et cetera, et cetera. And so I think one can be very robust. I keep using that word. We need to be very robust in terms of ensuring that the tobacco industry begins to pay for correcting the damage it has consistently done and continues to do with relative impunity.
Thank you, Andrew. I see Rob Cunningham and then Jeff Fong.
Sure. So one bit of good news is that if we look over the last 20 years, the percentage of people who smoke in the lower educational attainment segment or the lower income segment, we've seen declines in prevalence as well. That's very encouraging. And just to echo what Andrew said, is that we need to do a lot more. And we need to have much better funded government tobacco control budgets to do the initiatives that we're not currently doing.
Thanks, Rob. Jeff?
Yeah, I just wanted to pick up on what Andrew had suggested about polluter pays. I think now that concept that used to be quite novel is now relatively mainstream and growing steam gaining steam, advancing in a number of areas that are of great importance to the world. And I think that there is probably no other industry right now that a case could be made, that's stronger than in the tobacco industry. The UK, as part of their possible planning for their tobacco control plan is considering that kind of polluter pay concept that would feed into tobacco control action and programs. So England is, UK is one to watch with respect to this important concept.
If I could just add, the federal government doing the cost recovery fee provides a model for provinces who are being able to build on that polluter pay approach.
Mm-hmm.
Okay, thank you. Let's move on to another question. So before I go back to you, Emily, I did notice a question more recently in the chat asking, what are 2 or 3 measures, endgame measures, that panelists can point out as ones that we would agree that Canada should move forward on? So I think I can ask each of the panelists in turn what their responses to this would be. Perhaps we can start with Michael.
Sure. There are lots of ideas. I think one thing that is interesting me is the idea of decolonizing tobacco. That means we need to, the idea that the commercial tobacco industry is ultimately the problem. That tobacco has been an important medicine for thousands of years, but it is a medicine that existed, without additives, without processing, without papers, without filters, and existing in a spiritual and sharing environment. And so when we sell tobacco, I think that's where we should be aiming for. We also, I think, have the opportunity to look for other ways of nicotine to help those who are trying to move away from tobacco. And so reduced nicotine cigarettes, the potential of vaping, particularly on a prescription model, we're in an environment where commercial cigarettes are not sold. So I think we need to focus on changing the industry, changing the way we sell tobacco, the way we conceptualize the product, and less so on the focus on forcing people who are struggling to make them quit. It's not their fault. It's not their problem. It's the organization of the industry that we really need to change.
Thanks, Michael. Les, would you care to comment?
Can you repeat the question, Rob?
1, 2, or 3 tobacco, at least one tobacco endgame measure that you would propose moving forward.
Well, we need a starting point. We can talk about what it'll take to get to 5 by 35, but a really good starting point for Canada would be full Empower implementation. And we've dropped in rankings over the last 10 years from being among the top 12 or 10 or 12 to now number 30. In terms of Empower implementation, which is an evidence-based policy package that's advanced by WHO. But look, if we're going to call ourselves a world leader on tobacco reduction, and we can't even meet a minimum global standard like Empower, we've got a long way to go. It's a good place to start. Let's get started.
Thank you. Jeff?
Yeah, I just want to say that a lot of the policies like Empower and FCTC have been based on trying to break communication of the industry with consumers and potential consumers. But so we've put our own messages on packs. We've reduced advertising, et cetera, and we've increased some, media campaigns, to point out the harms of smoking, let's say. But the industry at all times has the most intimate and powerful form of communication. Every puff that is taken, the industry and their product and their design capabilities is communicating directly with the nucleus accumbens that drives addiction and continued use. Product regulation, Article 9 of the FCTC, holds promise in limiting the attractiveness, addictive appeal, and appeal in general of the product. It is very underutilized, and it should be explored as a possibility of bringing these products, especially cigarettes, to their knees. It may not work in political feasibility and so on, but there needs to be an exploration of the kinds of product-centered regulatory approaches that would significantly, has the potential for significantly reducing smoking.
Thanks, Jeff. Elizabeth, did you want to weigh in on this one?
Tough for me, simple oncologist by background. I guess I'm always troubled by somebody saying, what's the one or two things? If we've learned nothing else in the pandemic of the last almost 2 years, it is that there's never just one thing. There are a number of things that, like an orchestra, work together to create the end game that you want. So that picking one thing, and the chat is filled with vaping as if that's the one thing, it is just a small thing. I am reminded, and I can't remember who said this first, it might have been Cynthia Callard, that the perception about tobacco, commercial tobacco regulation has to shift from this push-pull around industry money to be thinking about how do we align how we develop the playing field with public health as the end game policy that we're interested in. And that will result necessarily in thinking differently about how that product is made available and sold, and for how much, and so on and so forth. But it also has to include industrial strength cessation approaches that don't look at a harm reduction model only, because as many people who have smoked and spoken to me about it, substituting another addiction for the one they have is not success from their perspective. It is leaving addiction behind that is the main thing. And there may be routes to that through harm reduction. So I guess I would say that focusing on the one or two is not enough, just like focusing on masks, focusing on vaccines, focusing on small gatherings, focusing on restaurants. They're not enough to control a pandemic. And one thing is not going to be the solution. So I think a really positive thing that could come out of this kind of meeting is to get people to say, we agree that a panoply of measures is needed, and we all need to sing from the same song sheet when we are interacting with government and those in positions of policy-making control to execute a plan that will have the multiple measures lined up and milestones and targets along the way. And actually, I think less than 5 by 35, we had some discussions, as you know, at the steering committee saying, ooh, 4.8% is not success. If we really want to get rid of death and destruction from commercial tobacco, it had a nice ring to it. It seemed achievable with a lot of effort, but really an end game is zero tobacco. And, you know, we shouldn't remove that from our playing, our playbook, because at the end of the day, this is a product that if it came to market today would never have been allowed to be sold.
Thank you, Elizabeth. Just instead of pointing at other individual panelists, does anybody have anything they'd like to add on this question?
Well, I can mention that I think it's just not one or two things, as Elizabeth said. I think we need a comprehensive strategy, taxation, legislation, and programming. That's why how we've been successful to date in Canada. 1965, prevalence in Canada was 50%. CCHS says for 2020 was 13%. We want to go below 5, and we need many measures.
Great, thank you. So I am keeping an eye on the chat a bit, and it is full of vaping chat or chatter. And so I think that we should address it to an extent. So maybe I'll just pose the question to the panelists: what is the role of vaping for Canada's endgame? What could it be? What should it be? And should Canada's endgame also be including less than 5% e-cigarette use by 2035? Andrew.
Well, let me jump in. I'm a firm believer in harm reduction. I think we have examples of in the opioid area of how harm reduction can be beneficial, and Dean Philpott mentioned that. I am, however, opposed to selling methadone when it's popcorn candy flavored in local gas stations and convenience stores. And I think the tobacco industry has done one very significant thing. it has thrown the cat amongst the pigeons here. And all you have to do is look at our chat, our conversation chat, and see the degree to which people have become preoccupied and diverted from addressing a fundamental issue by being caught up in the discussions that surround vaping. Yeah, vaping has a place, but vaping products need to be appropriately regulated, and virtually every nation in the world, with the exception of the United Kingdom, has recognized that. I will say nothing more about that, other than to say that as part of a comprehensive program, the kind of comprehensive program that Rob and Elizabeth and others have been talking about, we need to provide harm reduction approaches as part of that array of elements of the comprehensive strategy. But this does not mean that we make vaping consumer products, which are advertised and sold and merchandised in a metastatic fashion to 13 and 15 and 16-year-olds. We erred very badly in Canada in this respect and are now playing catch up.
Others?
Well, as previously mentioned, Rob, I mean, Canada rolled out the red carpet to Juul and Company, and that was a huge mistake. I think that nicotine, that vaping has a place in NRT modalities. You know, it's another means of delivering nicotine, but we've got an enormous recreational market and youth market that are completely undermining any potential public health gains that are to be made from nicotine replacement.
Thanks, Wes. Michael?
I think one of the problems with our conversations around vaping is the thinking again of vaping as a smoking cessation device. And I think this goes back to our old ways of tobacco control, and rather than thinking of really endgame strategies. The real opportunity for vaping is not about the vaping itself or the ultimate endgame for vaping, but what it may allow us to do for cigarettes. It opens the door for the type of regulations and restrictions on the commercial cigarette that may not have been possible without a device that was seen by consumers as an acceptable substitute. And I think if we see it in that way, if we see that this is a situation of leaded gasoline versus unleaded gasoline, you know, both have their harms, but we can, but one is clearly better than the other. We can restrict, we can get rid of the leaded gasoline. We can get rid of the combustible cigarette. And then worry about, you know, the effect of gasoline on climate as well. But you know, ultimately, we need to start thinking bigger, that transformation of the industry, rather than, again, putting the making individuals bear the cost of our failures in tobacco policy.
Thanks, Michael. Jeff?
Yeah, I agree with you know, what Michael has just said. Having a potentially viable alternative to cigarettes that kill half of its regular users is something that hasn't been around until relatively recently in the form of vaping products. So we need to be careful to figure out how that can be used. But if we can, you know, provide the kind of substitution that many smokers need, then that allows us to be bolder in the ways in which we go after cigarettes themselves. And I think that that type of strategy, the carrot and the stick, is the kind of thinking that, and of course, people are going to vary on one side or the other, but we need to consider those two together, because together, they're going to be opportunities for us to really cripple the cigarette.
If I can just add briefly, is that e-cigarettes need to be properly regulated. And governments were much better prepared in terms of legislation for legalization of cannabis than they were for e-cigarettes with nicotine. And that, and as been mentioned, we've had to play catch up. The other thing is that among youth, because of e-cigarettes, total nicotine use has gone way, way up. That's not supposed to be happening. And that's why we need proper regulation.
Thank you all. And I do see that we are nearing the end of our time. I wanted to make sure that we addressed that particular challenge. I'm just going to ask Emily, are there any other questions that we have missed that are of importance here to address?
I did notice there was quite a bit of conversation after Jeff's presentation about the New Zealand strategy and various elements, including the potential for community action, the smoke-free generation proposal. Some in the chat mentioned that it includes vaping as a cessation tool. And I'm curious if Jeff and others would see this as an endgame strategy. And if so, what some of the facilitators were in that context to bring that strategy into place.
With respect to a smoke-free generation or tobacco-free generation, depending on what version of it is, it sets a date, a year of birth, and those people and those born later cannot legally purchase the product, whether it's cigarettes or tobacco nicotine products. The concept is that gradually you increase the proportion of the population that cannot buy these things. And it's really debatable with respect to feasibility and sort of even legal kinds of, concepts here, because are you going to refuse a 57-year-old who shows up at the convenience store wanting to buy some product? I mean, there are a lot of challenges. Singapore was one of the countries that promoted this. New Zealand is considering it, although I'm not sure that's going to move forward. So that's one of those things that's out there. I don't know the status of it, either its feasibility or anything. I can't comment on that. My focus is really on product regulation, because I think that's the untapped potential for Endgame.
Thank you, Jeff. So I'm just going to give now last opportunity for any of the panelists to provide any comments that you haven't gotten in, or in response to any of the chat or the discussion that we've had.
Let me just say briefly, under 5% tobacco use by 2035 is achievable. We need to really accelerate our efforts, and let's do it.
Thank you, Rob. At this point, I want to thank all of our participants, the audience, those who are participating in the chat, and in particular to our distinguished panelists who have joined us today. As I said, a group of us decided to do this to mark 5 years. Elizabeth Eisenhower, once again, is the one who instigated this. I would say together with Les. I had both people coming at me almost at the same time saying, we've got to do something here. And here is the beginning. And we are planning to get together and to figure out what we can do more, maybe follow some of Jane Philpott's advice on how to speak with the next minister. And maybe now is the time, as a new minister is coming in. So once again, thanks all. Thank you to Sonia Johnson for organizing everything. We shall keep in touch. Thank you.
Bye, thanks.